Hi, I'm Shiv Gaglani. Thanks for checking out our Raise the Line interview series, in which me and my co-host, Osmosis Chief Medical Officer Dr. Rishi Desai, explore how to strengthen our healthcare system with some amazing leaders in medicine, technology, education, and government. And they have some great advice for people starting careers in healthcare as well. I hope you'll watch these highlights and then go listen to the full podcast interview wherever you get your podcasts. Hi, I'm Shiv Gaglani, and today on Raise the Line, I'm really happy to be joined by Kang-Xing. Kang is the head of health at Facebook and has been leading their COVID-19 response. He has worked on developing health-related products like a blood donation tool and health support groups, as well as how to stem the spread of misinformation about the coronavirus on Facebook's platforms. Kang was also Harvard 2006. He was in Eliot House, and we both were in engineering. I was Mather 2010, so I missed him by a couple of years. I would love to hear more about your background in your own words and the career trajectory that ultimately led you to becoming head of health at Facebook.
I joined right out of school, actually. I did computer science and psychology at Harvard, graduated in 2006, joined as a software engineer. And, this interest in like the intersection of, human connection and health has been something I'd been thinking about for a while. Then in my time in Facebook app, was just seeing more and more and hearing more and more of people using our products to meet health-related needs. And we're hearing from folks that this was often one of the most important things for them. And whether it's like connecting with other people who are going through similar challenges, or connecting with a doctor, or helping someone find a blood donor for their parent, we were consistently hearing that this was something that people were doing. And I just felt like we had a responsibility to better support some of these needs, and an opportunity to better support some of these needs. So this has been building for quite some time. This is 2018 now, and made the transition. And I'm really grateful that I have the opportunity to work on some of these challenges every day.
What advice would you give to someone who's considering a career in healthcare, and could be as a clinician, could be as a health informaticist? Would love to hear what advice you would give to our audience.
My heart goes out to a lot of the younger people here in college or so on who are just getting started in their career at this time. At least for me, it was hard enough to navigate the process and figure things out outside of the context of a global pandemic, and how that's, I think, disrupted a lot of things. One of the things for me, and this took me a while to realize, is kind of getting clarity on what I really valued and what I felt was more the most meaningful thing for me. I think that actually helped me ultimately ground, the direction I chose to go professionally, and taking this role about two years ago. It's something I'm really grateful I did. And, it's easier to explain it now, but certainly at the time it took a lot of reflection. And I think my main takeaway from that was getting grounded on, for me, just being able to work on a space that has a lot of personal meaning to me is something I'm both grateful for, but also has been really helpful for me professionally.
Thanks for watching this preview of Raise the Line. To hear the full interview, check out all of our podcasts and subscribe to the series. Please go to osmosis.org/Raise the Line podcast, or listen wherever you get your podcasts.